everyone. Thanks for joining us. Today's Giving Tuesday, and we're so excited to have you here with us on this day. And we're really hopeful that you'll consider giving to us and to our cause for Giving Tuesday. We actually have multiple funds that you can donate to. One is our standard Navajo and Hopi Families COVID-19 Relief Fund. You can donate online through GoFundMe, or even better, you can write a check to us through our fiscal sponsor, Nonprofit Legal Services of Utah. There are instructions on our website, which is www.navajohopisolidarity.org, for those two different ways of donating. And then the other way you can give is to our Resiliency Fund. And the distinction is that the Relief Fund is really about, direct sort of defensive response to the COVID-19 pandemic in our community, which unfortunately is longstanding and will remain with us for the foreseeable future. So that is just really focused on urgent needs. And then there's a little bit of proactive work there as well in terms of raising awareness of the benefits of vaccines, underscoring that that's our best defense against COVID. But most of that funding and what we're fundraising for right now for that fund is going to be focused on direct relief, and specifically our Delta Relief Program, where we're getting isolation kits to families in need. And then the Resiliency Fund is sort of long-term sustainable change, because we never want our communities to be in this situation again. We don't want to be on the offense or on the defense all the time. And so the Resiliency Fund is basically us being on the offense. Like, how do we strengthen our communities for the long term in terms of food security, cultural transmission, and just the development of a local economy, so that we're not subject to supply chain disruptions, and we're producing locally our own food and sustaining our communities, and we have that security against things like pandemics or climate change threats. And so with that program, we've launched a community center in Monument Valley, which is doing wonderfully. You can learn more about it on our website. We have high attendance rates. And so again, the link for both of these funds is on our website, www.navajohopisolidarity.org. And we'll put the link for our website in the chat section so that you have an easy way to click to it there. And we'll also put our GoFundMe direct links there as well, because sometimes I don't even know where my checkbook is, right? So I totally get it if you want to donate online. Anyway, so I just wanted to share with you guys a little bit about our story. We have been tremendously successful in our relief effort. We launched it very early, March 15th of 2020. I was watching what was happening with COVID-19, as were many of the other women on our leadership team, and was really concerned, because I know that we have many elders who live in very remote areas that are traveling 2 hours one way to get to a grocery store. We have 13 grocery stores on Navajo and Hopi nations, and those grocery stores have never supplied our full population with food. So when the prospect of our economy shutting down and borders being closed arose in mid-March, I was pretty terrified that our people would not be able to get the food, water, and PPE that they needed to protect themselves, and just to sustain life, right? Because half of our population buys their food off reservation. And then, as I learned more about this, I learned that 77% of our population experiences food insecurity in the best of times, which is a bit terrifying to think about. And of course, in 2020, we had just come off of the shutdown of Navajo Generating Station in 2019, which was a major source of jobs. Some estimates are 400 jobs or more. So the economic security in our communities was not strong when the pandemic hit, and of course has never been strong. We regularly have 50% unemployment on Navajo and Hopi in the best of times. So there was a lot of concern to be had, and then also taking into context the underlying conditions in our community. we have high rates of diabetes, high blood pressure, obesity, and a lot of these can be traced back to the fact that Navajo Nation has been a national sacrifice area for almost a century now. Our tribal council was formed for the express purpose of dispossessing us of our natural resources and making those available to the United States government and to United States corporations. And very little has been left behind in terms of enriching our communities, and a lot has been taken. What has been left behind are the negative externalities of the extractive industry activity on our nations, like over 1,000 uranium mines, and the radiation and the cancer that comes from exposure to those mines, because people are continuing to live in their homes that their families have lived in for generations, don't want to move, and there's no aggressive activity to come in and clean up the contamination that's been left behind. And then we also have the legacy of coal and the asthma that comes from that, and the cancer that comes from that. So, there was lots of reason to be concerned. And then you add on top of that the fact that a third of our communities on Navajo and Hopi don't have access to running water. So their ability to wash their hands easily was limited, and even just access to clean drinking water is limited. So there was that concern, and then the concern of our community, a third of our community not having electricity, which of course meant that they wouldn't be able to store food for very long. And so there would be a repeated need to access a food source for those families that don't have access to electricity if they wanted to have fresh food. And of course, we know that having a healthy diet filled with fresh fruits and vegetables and other fresh foods is important to building up your immune system and protecting yourself from contracting COVID. So in that context, our team stepped forward with a very strong sense of urgency. And thank you to all the beautiful people of the world for stepping forward and funding us in a very tremendous way. We were wildly successful. We were one of the top 5 fundraisers on GoFundMe in 2020, alongside social justice efforts, fundraisers for Breonna Taylor and George Floyd. And so we were incredibly thankful for that. And we have put those funds to great use. We've been very active. In the middle of April, we were able to scale up to a point where we were bringing $100,000 to $200,000 worth of food, water, and PPE to our communities on Navajo and Hopi nations. And we were able to mobilize about 1,300 volunteers. Our own Navajo and Hopi people stepped forward very bravely. We have one of those individuals here with us today, Hector, and of course, Mary, was a volunteer very early on as well. So we were able to serve over 500,000 Navajo and Hopi people with food, water, and PPE. And we were able to sustain that level of distributions from the middle of April of 2020 until late March of 2021. And that was our goal, to get ourselves through the cold and flu period, when we felt like contraction rates would be really high. We didn't know how COVID would interact with the cold and flu environment. And that was a really dark time for us. We lost many people contracted COVID during that time. So we were very thankful to all of you for making it possible for us to provide relief to our people during that difficult time. And then we were sort of depleting funds dedicated to COVID relief, and started winding down our operations. We stretched them as far as we could, collaborating with USDA, and I think in a few instances, St. Mary's Food Bank, to keep food distributions and PPE distributions going through the end of May. And then we also were able to keep our PPE distributions going through the first part of, pretty much through the end of June. And then things were looking really great. Navajo Nation had an aggressive vaccination rollout. Lots of people stepped forward and got access their vaccines early. And we were hearing about the emergence of the Delta variant, but things were looking really good on Navajo. You know, the contraction numbers, the number of new daily cases dropped very low to like single digits. And it was a really wonderful time. But we were still tracking what was happening with Delta. Just because we wanted to know, you know, as soon as this emerges in our community, we want to be able to step forward and respond and protect ourselves the best way we can. And so we were tracking that, but also trying to move forward. And so we felt like, okay, we don't need as much of a direct relief response because there's not so much COVID in our community. So we shut down our direct relief operations in early July. And then we launched August 1st, our first community center in Monument Valley. And we're hoping to, you know, continue that resiliency-based work going forward. And then in July and August, we started observing rapid doubling of the weekly new case numbers of COVID. And we knew that this was, you know, related to Delta. We were starting to see that nationally, especially late July, early August. And pretty much since then, we have been in the throes of a Delta surge. So by the end of August, we felt that it was necessary. You know, we had one day, August 27th, my birthday, when we identified that we had over 400 new cases in that week. And so I had been communicating with our board of directors, and we felt like that was the time. You know, those numbers were unacceptable. You know, we have a domestic population of about 160,000 people. So 400 new cases in a week is very significant for that population. So we launched a Delta relief program, and you know, I have Hector Begay here with us right now, and he's going to tell us a little bit about what it's like to be on the front line, you know, implementing this Delta relief program. And then Mary Francis, who runs our direct relief programs, is going to share with you a little more detail on exactly what the Delta relief program is and what our objectives are with that program. So I'm going to go ahead and hand things over to Hector to tell us a little bit about Delta relief program and what it's like on the front line. So Hector, take it away. And I will just also mention that Hector has been with us since day one, basically. He was our first direct relief employee that we hired last winter. And it's been a pleasure and a joy to work with Hector. And so we're so happy to have him here with us today.
Gosh, you got me all blushing. Thanks, Ethel.
Sure.
Hi, Mary. Hi, Mahayo. Hi, everyone. Those that are tuning in. Let me first introduce myself. My name is Hector Begay. I am Cheyenne Arapaho, born for Towering House. They are also my Chase, and Red Bottom Plan are my Nolly. So the neck achiko a nasanin na shlo kia ani e pashichi asche das navedo kia ani nam dashiche. Well, it's an honor to be here. Thank you for allowing me to chime in with relief aid, relief initiative. I am a team member here in Jedito. Amanda is my team lead. And as Ethel mentioned, I came on board back in October, and I'm very privileged to still be a part of this organization. Hands-on experience, working from May 2020 as a volunteer to coming on as staff in October 2020 and still being staff. Just the rates of numbers from COVID positive families increase, it really does open up your eyes to how the severity of how people take serious. When me and Amanda are out there fulfilling Delta relief calls for isolation kits, we question how serious are they about this virus. I'm not sure if many of you are aware, but I myself have contracted COVID last month. It was exactly right on Indigenous Day that I was exposed to COVID-19 through a friend. You would think working with direct relief here, I would implement all PPE measures. I do, which I do, I make sure that I spray myself. I'm always sanitizing, washing my hands, double masking. And the one time that I let my guard down was the one time that I contracted it. And with that, there's the rippling effect that comes with it. I, I gave it to my mom, my brother, my whole household. And then my teammate Amanda was also exposed, and it really brought us down. And not just a little bit, like it brought us down. My mom and my teammate were both hospitalized because it affected the respiratory system. My brother, he's not vaccinated, but he's got more of a stronger metabolism and stamina than I do. Whereas the only thing that affected me was a slight chance, but the breathing, it really hurt my chest, and it was a big eye opener. Seeing that the severity of it, and it really made me question and think, if the vaccinations weren't available, it would have been even worse. That's something me and my teammate keep talking about, is how bad it could get. We look back to the year 2019, when many lives were lost to COVID-19 back before the vaccines were first brought out. And honestly, thankfully, I only was sick for about 2.5 weeks, and then I recovered well. But my brother took it the hardest, and we all have different mindsets. We're all different people, and we have different choices we make. But I believe, if we develop that herd immunity, we could really slow the spread. But now back to work, and I'm grateful. It's just a shame that a lot of our people here on Navajo Nation have really put their guards down. A lot of them are really not taking it serious anymore. Now we have this new variant that's coming out, and it's kind of a little scary, not knowing what the severity of it is, even though it's a lot different. It's mutated from the Delta variant. But as someone that works on the ground, it's a lot of work. There's a lot of work that goes into it, behind the scenes. There's a lot of work that goes into delivering an isolation kit, or prepping a food box and sanitizing, repackaging. There's a lot of loading, lifting, and a lot of close contact also. But we are trained. We've been doing this for over a year. We have taken many protocols. We have done many training. We have made sure that in our staff meetings that we know what we're doing, whereas we don't want to be a liability to somebody that that could catch it. But I hope that helps. I hope that's helpful.
Yeah, definitely. Thank you so much for sharing some of that, Hector, and about your personal experience and the need for our community to fully vaccinate. There was a very problematic meme that circulated over the summer, and there was a lot of hype, even in the spring, about how highly vaccinated Navajo Nation was, and the meme that circulated said that 91% of Navajo Nation was fully vaccinated, and that's just not true. Only 58% of Navajo Nation is fully vaccinated, which is, not even as much as the average in the United States, which is a pretty deplorable vaccination rate, considering that we have such full, easy access to the vaccines. And we're not even as highly vaccinated as the state of Arizona right now. And as we know, Arizona is not exactly a model for vaccination in response to COVID. And so we're working very hard through our Protect Community Vaccination Campaign program, which Hector is also a part of, calling folks and asking if they're vaccinated, encouraging them to get vaccinated. Hector's actually been successful at flipping some people and getting them vaccinated. So we're very thankful for that. But that's part of the battle. That's, again, an offensive measure, trying to protect our communities without reacting. But meanwhile, we want to make sure we're saving lives as people are struggling through COVID. And so Mary will share with you a little bit about our Delta Relief Program and that sort of approach. So Mary, would you like to give us an overview of Delta Relief Program, what our objectives are with that, and some of the numbers associated with that?
Sure. Thank you. Thank you, Ethel. And thank you, Hector, for sharing your perspective and your experiences with the deliveries and just working with us. So thank you. So for the Delta Relief, just explaining, what the Delta Relief is. Basically, we have a team of, well, we started out with 5 teams and now we're working on 7 teams, but we have teams across Navajo Nation. We have, two teams, or a team in the southwestern area, Western Navajo area, a team in Monument Valley, Chinle, Gallup, and then Upper Fruitland most recently. And then we're working on forming a team in Shiprock to cover the Shiprock area. But yeah, we receive requests through from online. We also get phone calls. We have a hotline that Vanessa's office answers, and they'll forward the calls to us to make sure that we're responding to all the requests. And so far, since we started back in September, we're on week 14 of the Delta Relief Program. And when we first started, we were getting requests anywhere. Our requests were like coming in at like 5 requests, and now we're anywhere between 35 and 40. Like the week before we had 40, and then last week we had 35. Yeah, we're the amount that we're spending on each request is about $400, plus the $50 PPE kit. So that's a total of like $450 for a complete isolation kit. And in the isolation kits, we have we try to include groceries, cleaning products, of course, the isolation supplies and things like that. And, generally, we're responding to a home that has a COVID positive individuals. So we try to make sure that we include medication that it alleviates symptoms for the person that tested positive. But so far we have spent $58,000 on supplies since September, and yeah, so that's what we have provided so far. With the isolation kits, I'm so sorry.
Can you tell folks how many people we've responded to in the last week, or maybe the last few weeks? And do we have the number for how many families, households? We always respond to a household, right? Like even if it's one person who's sick, because as Hector shared with you, if one person's sick, we assume the entire household is going to contract COVID. There's a very high risk of that. We have lots of overcrowded housing in our community, or I like to think of improperly sized homes for our families. And so it's hard for people to isolate in their home. And yeah, so that's why we serve the entire family. And to that end, some people not everyone's going to be sick at the same time. So some people can still have the fresh fruits and vegetables and like the milk or whatever. But then other people are not going to be able to eat. Like they're just going to want broth and Gatorade. And so we include all of that mix. We, after Hector went through his experience, and we had other team members that were impacted as well, we consulted with them and incorporated their suggestions to make our relief, our isolation kit stronger and more responsive to the needs of families. But I think one of the really important things that we include is 2 of the contactless thermometers. You know, we wanted to make sure that the sick members of the family had one, and then the well members of the families had one, so there was no risk of cross-contamination. And the same thing goes for oximeters. So we provide 2 of the oximeters, and you know, at least one medical facility on Navajo Nation doesn't have oximeters to give out at all. Another one is reusing them. So asking people to return them and then cleaning them and handing them out to new families. And so we just felt like we need more of this supply in our communities. And that's why we include these items and include double of those items. We also include the KN95s for the sick person, so that there's even less risk of them spreading to other members of the family. And kid masks if there are kids in the home. And so that's a little bit about that program. Hector or Mary, is there anything else you think we should add about that folks should know about our Delta Relief Program?
Well, in answer to your question on how many families we've served, last week we served over about 33, but I know we have some that we still need to serve, and last week's orders totaled 10,400 approximately, that amount. And I see here we've served, I mean, it's like 172 people that we had to serve. I mean, the families, they range anywhere from like a household of 4 all the way to 10. So it just varies on our deliveries.
And some of these households, I mean, we ask, do you have running water? Do you have electricity? So we can know better what will actually work for the family. If they don't have running water, then we also include a hand washing station.
Yes.
Yeah. Hector, is there anything you'd like to add about Delta Relief that people should know in terms of the assistance we're providing folks?
I guess, well, one advice I like to share with everyone is, continue to mask up, continue to wash your hands. Bashes now didn't, Bashes has put back up their hand washing station, but it's optional. It's only optional, but I want to encourage you guys to wash your hands, sanitize, wear gloves if you're at gas or you're out in public. And if anything, keep in mind that this virus is airborne. I could be sitting here, positive, and a family member like 12 feet away, we're inside, and they could still contract the virus because I'm out here talking away. But that's just, don't let your guard down. And yeah, halne, that's one thing I just like to say, because it's a lot of work.
Yeah, absolutely. Yeah. I've been looking at timesheets for our teams. Today was payroll authorization day. And, like some of these responses take 6 hours because it takes, 2 hours for our team members to get to the home. So I want to commend our team, our frontline staff who are out there. We have 6 distribution sites or 6 teams, response teams. We have 2 in New Mexico, one in Upper Fruitland, one in Gallup. And then we have, of course, Hector and Amanda covering Southwest Navajo. We have a Western Navajo team, and they're also covering Hopi. Actually, I think Hector's team also covers Hopi, depending on whoever's closer. Then we have a Northwest Navajo team that's covering Utah and Kayenta area. And then I think that covers everyone. Did I leave any? Oh, Chinle. Chinle is really the core of our operations, and that's in collaboration with the phenomenal Chinle chapter and their leadership. especially Walt Yazzie and just phenomenal staff. Those guys are like putting together our PPE isolation kits and getting those out all over, running relays all the time. And so I'm just really thankful for the amazing staff that we have and the commitment that they show. And you know, they're like sterilizing, they go to shopping, they sterilize these items. It takes a lot of time and care. And then they have to maintain those items, you know, in their disinfected status until the point of delivery. And then they have to be careful to not have contact with the families, especially because we were like, we know that this family is sick and we know that there is a real threat of contraction. And so, but that's one thing I wanted to add, Mary. I think you were going to add something as well.
Oh, I was just going to share our hotline phone number. If you're not able to, I mean, you can always find our form online. If you go to our website, the Navajo HopiSolidarity.org. And, you know, if you click on programs, you can see a little flyer there that tells you about the program and what, you know, we're able to do to assist you. And there's also like a little pop-up thing where you can immediately see the form. And if you're not able to fill that form out and, you know, you need assistance, you're not able to fill that form out, you're more than welcome to call the 800 number, which is 833-956-1554. And yeah, just continue masking up, be careful out there, try to avoid the social gatherings if you can. If you have to be there, please wear your masks. You know, carry hand sanitizer with you at all times if you have to, because, you know, water is not readily available to us when we're out on the reservation. So please, and let's see. I believe that's the only thing I wanted to share.
Yeah, and I just also want to underscore sort of the magnitude of what we're trying to do here. You know, definitely trying to save lives. We're in a context where there isn't a lot of access to food. Again, 13 grocery stores for a jurisdiction the size of West Virginia / about the size of Ireland. And so food is far from people in most instances. And in fact, most people do their shopping off reservation because there is an inadequate supply on the nation to begin with. So, you know, our 6 teams are located all across this huge jurisdiction, and they are traveling. And I don't think we travel less than an hour to do any one delivery. And our team is very responsive. You know, Mary's tracking the help requests every single day, multiple times a day. And usually we're able to respond within hours. And which is that's not something anybody else is doing on Navajo Nation, to be honest. The healthcare facilities don't have the capacity to respond that quickly. And they have we just go on the honor system. You know, if someone says that they're sick, we trust that they are sick. And I don't think we've ever been in a situation where someone has not actually been sick. And Mary could tell, you know, talking to people on the phone, she can hear that they're having breathing difficulties. And so, you know, we respond quickly because we know people's health is on the line, lives are on the line. Not only that, but the potential of spread in that household is also at a very high level. And so if we can get the KN95s to people and help them do the isolation and also just track their symptoms, like with the oximeter, those oximeters are saving lives. Same thing with the thermometers, and being able to monitor the healthy folks in the household so that they know when they're coming down with COVID and they need to isolate, being able to monitor the folks who are sick so they know when to go to the ER. Emergency response on Navajo Nation is inadequate. Many of our roads are unpaved. We don't have an addressing system, so EMS has a really tough time finding homes. So if someone waits until they're at the point where they need to call 911, they're in a really tough spot because they probably aren't going to get a response in the time that they need it, unless they live, on a paved road. But many of our people don't live on paved roads. So your donations are really meaningful and are actually saving lives. So we are very thankful to all of you because Navajo Nation's received millions of dollars through the CARES Act and for COVID relief through ARPA, and none of that money has gone towards direct relief. And so, there's not, and most direct relief programs on Navajo right now have shut down. We don't have World Central Kitchen here anymore. We don't have, CORE. And so we're kind of the only game in town right now. IHS has some resources here and there, and Navajo Nation does have some stockpiles for some things that they have purchased previously, but it's not going out to people in real time the way that our relief is going out to folks. So anyway, just want to leave it at that and urge you to donate and help protect our communities. And hopefully you've learned a little bit about why our community continues to be hard hit. My understanding on last week's town hall with the Navajo Nation president was that we're actually, back in May of 2020, we surged ahead of other jurisdictions in terms of having the highest contraction rate in the country. And now we're sort of in the 6th spot compared to the other states. So we are again rising, unfortunately, despite the strong advocacy for vaccination in our community and the strong access. I mean, Hector was fully vaccinated. The other members on our team who've come down with COVID were fully vaccinated. But when you're in an environment where almost half of the population is not vaccinated, then that is an environment ripe for the spread of COVID. And unfortunately, we are in that context at Navajo Nation. And we are in a community where there's a high prevalence of underlying conditions. So even if you are fully vaccinated, your baseline immunity was lower to start with. And so you remain vulnerable to COVID, even though, having been vaccinated, your symptoms will not be as severe. But anyway, so just some parting thoughts for folks. And I don't know, Mary or Hector, if there was any final thing you wanted to add. So thank you.
There is something, Ethel, I wanted to add on. If you don't want to donate, you can always go to our online store through our website, and those funds can, help us continue our efforts that we're doing down here. Our online store has a variety of items that you can keep for yourself, from hooded sweaters to t-shirts to little stickers and water bottles. That's also another way to donate to our cause, because without your support, we can't do what we can't do what we're doing to help families that are in dire need of these isolation kits and this fresh food. Some people don't have transportation. Some people, it's hard for them to get from A to B. But thank you all for your support, and keep us in your prayers as we frontline workers battle this virus.
Mary, anything final?
Yeah, I just want to say thank you for your continued support and donations, everybody out there. Yeah, it's really difficult sometimes to hear some of these calls. There's families that really need it. There's children who have caught COVID, and parents, have no other way to get help for their kids. And these supplies go a long way. The money that the donations that go into these this program, it's making a difference, and it's giving hope to these families. And I just want to say thank you so much for supporting and donating and just cheering us on to help these families, because we need the support. we really do need the support. There's, so many families out there that need us. And just thank you.
Yeah, absolutely, absolutely. And one of the things, we had a family that had been responded to in, I believe it was the Aneth area. It was a Utah family. And, they recovered from COVID, and they encountered some of our team members shopping for another family that we were responding to. And one of the things that the woman mentioned was that it was just, so heartening to her to know that someone cared and that someone was out there doing something to help, because there was nobody else that she could call for help. And she was just so incredibly appreciative. And so that's what you're making possible, in addition to, saving lives, but you're also spreading love, and hope in our communities. So thank you very much for what you're doing, and thank you for considering donating to us. And everyone have a beautiful rest of your year. Thank you. Go on.